In cases, there are a few choices of antidiabetic for Mr. H. So firstly, vitamins such as metformin can be used as the first-line treatment for type 2 diabetes mellitus. Secondly, SGLT2 inhibitors such as dapagliflozin or empagliflozin can be used as the choice of the treatment as well because of their demonstrated cardiovascular advantages and potential to lower the risk of hypoglycemia. Thirdly, in addition to their potential for weight loss, GLP-1 receptor agonists like liraglutide or semaglutide have also demonstrated cardiovascular advantages.
So why we choose metformin and GLP-1 is because metformin, it can reduce the hepatic gluconeogenesis and it has lesser adverse drug event and also relatively cheap. And why we choose GLP-1 is because it can be used to increase insulin, reduce glucagon, and also increase differentiation and also the beta cell function. And the benefits also include neuroprotection and cardiovascular benefits and also has lower risk of hypoglycemia.
Sodium glucose co-transporter 2 SGLT2 inhibitors such as the empagliflozin will be our choice for add-on drugs. This is because the SGLT2 inhibitors act on the proximal carotid tubule in kidneys, which reduces the reabsorption of glucose and increases glucose excretion. This lowers the blood glucose level. It is also helpful for Mr. H who is an elderly because it reduces the risk for renal failure and heart failure.
Strict glycemic control offers Mr. H numerous benefits, preserving cognitive function, reducing complications, and enhancing emotional well-being. By stabilizing blood sugar levels, he can recognize family members better, lower the risk of diabetes-related issues, and experience improved energy and mood. These measures promise Mr. H a higher quality of life, empowering him to navigate daily tasks with greater ease and confidence.
However, strict glycemic control could also put the patient at risk. Firstly, it can increase the risk of hypoglycemia, leading to symptoms such as sweating, trembling, and in severe cases, loss of consciousness and seizures. Secondly, it can also increase the risk of cardiovascular events. And lastly, it can lead to weight gain in some individuals, which may exacerbate other metabolic risk factors.
So what are other issues that could be addressed with Mr. H? So, for the first, is occupational therapy. And occupational therapists can assess Mr. H's self-care skills and recommend strategies to maintain his independence for as long as possible. This could involve adaptive equipment, dressing aids, or techniques for showering and toileting.
Other issues I'd like to address for Mr. H would be his cognitive decline, by understanding and acceptance. Depending on the diagnosis, it might be helpful to have an open and honest conversation, tailored to his understandings about his cognitive decline. Support groups or educational resources can be helpful for both him and his family.